Hi, my name is Mark Doyle and I'm with Pear Healthcare Solutions, and I'm here today to talk to you about the COPD6. The COPD6 is a device to test for lung function, and in our program we can use it to screen patients for COPD and also use a number that the device gives us called lung age to be able to counsel patients and motivate them to quit smoking. If you're watching this video by now, you should have received this bag that contains everything you'll need to do your risk assessment clinic program related to COPD or smoking cessation. Inside the bag, you'll find a couple of components, one being the screening device, which is called the COPD6 and looks like this. It's a simple device to measure lung function. And there's also included with this bag a mouthpiece. The mouthpiece is designed to have a one-way valve on it so that there will be no contamination from somebody who's used the screening device previously by way of them inhaling any sort of bacteria or germs that may have been there from somebody who's used the device before. The device will measure FEV1, which is forced expiratory volume at 1 second, and also FEV6, which again is forced expiratory volume at 6 seconds. And using those numbers, it will give a risk assessment for COPD and also report those numbers back in an FEV1, FEV6 ratio, and also calculate what's known as lung age, which is a very good number to use when talking to customers about smoking or quitting smoking. It's a number that relates to their current state of health and can be used as a tool to engage them in a smoking cessation program so that they can get back on track and repair damage and improve their health. There are a few things to look at on the device itself that I wanted to go over with you. The power button, obviously, to turn it off and on. And then we also have a couple of navigation buttons that will bring numbers up and down or help us to make selections. And then once we have decided where we need to make a selection, there is the enter button, which is the center button there. To show you around some of the functions of the device, first, obviously, we need to turn it on. So there is the power button. The power button, once it's on, will display age and also quickly show you the battery level. I would recommend that you make sure the batteries are charged and full. If you haven't used the device in a while, I would suggest replacing them so you make sure you have nice fresh batteries so you can get an accurate result. The first number that's displayed when you first turn the device on is age, and typically it defaults at 50. So setting a person's age, you would use the navigation keys either up or down to get to the appropriate number. Now to get to my number, which is 40. And then when we're ready to commit that number, we just push enter, and now that number is locked in. The next number it asks for is height. So height is measured in inches with this device. So I'm 5'9", so that means there's 12 inches in a foot. 5 foot, that makes 60 inches plus 9 makes 69 inches. So I will go all the way up to 69, and that will be my height. When I'm ready to commit that, I push enter. So that's the height. Now it's asking me for gender. The device will default to female first, and the female is the symbol is the little circle with the cross at the bottom. So circle with the cross at the bottom is the female symbol, and then if we use our navigation to move to the other selection, you'll see a change to the male symbol, which is the little circle with the arrow pointing out in the top corner. So that's the male symbol, which we're going to select for me. And then it will automatically move on to ethnicity. There are a few ethnicities that are calculated into the database that will affect the calculations. The ethnicities are Caucasian, African American, and Hispanic American. I think you can make that determination when you're sitting down with a customer as to which would be appropriate. And if you're unsure, I would just default to the Caucasian number. So moving along, we're going to select the Caucasian. And once I've done that, now it's ready for the actual test. So when you're sitting there with your customer or patient, it's important that they are sitting up straight. so that their head is level and they can get a good deep inhaled air. And then when they're ready to do the test, they need to blow everything out as hard and fast as they can. Now the test does require you to do a 6-second blow. Granted, most people will be out of air after probably about 3 seconds. But it's important to let them know they need to inhale and then exhale and push everything they've got right out the gate, not a nice slow, easy blow and try and make it last 6 seconds. I've noticed when I've tried training some people, they try to make this last as long as possible because they figure they have to blow for 6 seconds. That's not the idea. I'll just quickly demonstrate so you can do this. And I would suggest that when you're doing this with your customers, your patients, to do the same thing as well, to demonstrate it so that they get that you need to go full force. Now what they're to do with the mouthpiece, obviously with the device, but if you're demonstrating it, all you need is a sample mouthpiece that you can reuse over and over again. But what I do is put the device in the mouth and make sure you just kind of bite down on it. You don't want any obstruction. You don't want the tongue in the way to sort of obstruct the air. You want good flow right out of the device so that you're getting a fantastic measurement. So just put the device in your mouth and just form a seal around it with your lips, and then take a big deep breath in, back straight. And that's what it would look like. And then the device will beep after 6 seconds, letting them know, okay, now you can take out the device. If they have no air after that 2 or 3 seconds, and they still need to try and just push out anything that they have in there, that's okay. It doesn't have to be a full force at 6 seconds. You just want to make sure one full deep breath right from start to finish, and as much and as fast as they can. That is the key to making sure you get a successful measurement with this device. So now you're ready to do this with your customer. After you've shown them how to do this, by you demonstrating through a mouthpiece and having them be prepared and ready, you want to make sure that they're sitting down comfortably, have their back straight and head level, and make sure there's no obstruction in front of them, especially a person. You don't want anybody standing there and getting blown at. So you will ask them, put it into just do as you had shown them before, putting it in their mouth. Take a deep breath. There you go. So as you heard, the device beeped after 6 seconds, and all I did was blow, giving everything I got off that first blow, and just pushed as much as I can until that beep. I didn't try to inhale again. I didn't try to blow again. It's just one continuous blow. And at the very beginning of that blow, you got to give everything you got right out the gate. So to get an accurate test, we need to do this 3 times, because what we're going to do is we're going to take the best of 3 results, and that's what we're going to use for our screening number. So I'll do this again. And we'll have to do it again. And I would recommend, when you're sitting there with the patient, making sure that they're okay, because that does take a lot out of you with that wind. If they need a little rest in between, that's okay. Let them rest. You don't need to have people passing out on the pharmacy floor. And now we're going to have them do it again for the 3rd and last time. So take a deep breath, everything straight. And that's our 3rd result. So now we're ready to look at the results. So looking at the results on this device, we can remove the mouthpiece now that we're done our test and throw it in the garbage. And we can see that the first number that comes up on the screen is the FEV1 and the expected result percentage-wise. So the FEV1 for me is 3.53. So I would just make a note of that, 3.53 as the FEV1. And then moving along, we push the button up and it will give us the FEV6 number. So the FEV6 is 4.0. 0.06 or 81%. And we scroll up again, and we have the FEV1 to FEV6 ratio. So that number is 0.87 and is 106% expected. So those are important numbers for the physician. So if you're going to have anybody follow up for spirometry as recommended by the device, definitely those are numbers a physician is going to be interested in knowing. And so some of the things that are also available on this device are a recommendation for spirometry. So you see this chart here with the green, the yellow, the amber, and the red. That is an indicator that will tell you if the spirometry is recommended. So in this case, fortunately for me, I'm in the green zone, so spirometry is not recommended. But if it were in the others, you would definitely want to record the numbers that we collected on here and recommend that they follow up with a physician for a proper spirometry test. There's also a COPD risk indicator, so there are different classifications for COPD risk, 1, 2, 3, and 4. And if the arrow is beside any of those numbers, you're also going to want to make note of that. Moving along to the next number, it will show me is my lung age. So my lung age is 40. Thank goodness. I wasn't expecting it to be that. I've been a smoker for a number of years. I quit about 3 years ago, but I guess what this is showing me is that I did it for good reason and that I'm well on my way to becoming a regular, normal, healthy person. Well, at least regular and healthy. I'm just going to show you what would happen if you got a bad blow. The device has a built-in sensor to detect if the blow wasn't proper or somebody coughed or tried to blow twice and all of that in the single thing. So I'm just going to show you what that might look like. So with that long beep and then followed by the 2 beeps, it's letting me know that that wasn't an acceptable blow. And you can see that there's an exclamation point beside that result. So that's indicating that that blow wasn't the best and you should try doing it again. And as I said before, just make sure they're sitting upright, big deep breath in and full force, everything they've got all the way out, and then hold it in their mouth for 6 seconds or until the device beeps. So to change the batteries is pretty simple, straightforward. Just pop the back off and you can take them out one at a time and replace them if the battery indicator is telling you that the battery levels are low. And as I said before, just make sure that they're always fresh, because you want to make sure you have good results when you're doing this test. Another point of housekeeping to clean the device is pretty straightforward. You can take an alcohol swab and just wipe the face of the device and the buttons after you've used it. And to clean the head, you just pull off the top, getting a good grip on the bottom and placing your thumb underneath the hole there and just kind of slightly wiggle and pull off the top. And then you could rinse this off in a warm soapy water solution and just rinse it and let it dry, and that will be enough to keep that part clean. And then once it's all dry, just reattach it back to the device. I recommend cleaning the device once a month or about every 100 test subjects to make sure that the device is clean and working properly. You want to make sure that when you do have it apart, that if you're trying to clean it, don't stick anything in this area to disturb the veins. The parts that are inside of the head of this device are specially calibrated to be able to get an accurate measurement. So if you're cleaning, don't stick any swabs or anything, and you don't want to disrupt the veins in there that spin. So just warm soapy water, rinse it off, and let it air dry. And when you're ready to go, you just attach it back on.